Hello, I'm Gloria Jean. Welcome to the New York State School Counselor Association panel discussion on mental health education and the role of the school counselor and of the comprehensive school counseling program. I'd like our panel to introduce themselves.
Thanks, Gloria. I'm Kathy Haley. I'm an elementary counselor in the Syracuse area, and currently I'm a Region 6 governor for the NYSCA board.
Hi, Gloria. I'm Chris Shear. I'm an assistant director of PPS in the Schenectady area, and I'm the immediate past president of NYSCA.
Hello, Gloria. I'm Jeanette Alomia. I'm a school counselor at a secondary level high school on Long Island, and my role is the VP secondary level for NYSCA.
Thank you. And our guest.
Hi, Gloria. Thank you for inviting me. My name is Amy Malloy, and I'm the director of the School Mental Health Resource and Training Center, which was established by the Mental Health Association in New York State to help schools comply with the new mental health education law.
Wonderful. Amy, can you tell us a bit about the mental health education law?
Sure. Yep. The mental health education law took effect in July 1st of this year. It applies to all schools and all students, grades K through 12, and it requires schools to teach about mental health as part of the health education curriculum. When we advocated for this law, we really felt that mental health education was a public health imperative, and that it required a public health approach, meaning that everybody in a school community could benefit from learning about mental health. So not just the students, but the staff and the families as well. We set up the Resource Center not only for schools, but also for families and students to access and community providers to access.
So this is not just for health educators.
No, not at all. And in fact, we really think that, and my experience in talking with schools across the state is that as schools begin to look at their plans and make decisions about what their mental health education curriculum will look like, they will utilize their partners in the schools, such as the school counselors, the school nurse.
All right. So the Resource Center, is this a physical place that people go or an online resource?
It's online. It's primarily online. But we also have an education consultant in our office who can respond to phone calls or email inquiries. And then we also have some regional representatives across the state who are kind of positioned to be able to provide in-person training, professional development, or support. The Mental Health Association has affiliates across the state that cover about 50 counties, and they're partners as well. So they can provide professional development for staff. They can come in and provide instruction for students.
Certainly, mental health wellness is not something new to school counselors. It's been part of our role, one of our domains, and K through 12 at looking at the social emotional development of students. What are some of the services that are already provided for mental health concerns in your school?
My experience has been that once lessons have been done, and we've partnered with our health teachers to do lessons regarding just overall wellness in students, is that we're also available for the follow-up piece. So it's not just a one-time, it's kids are coming down to the office to talk about the lessons that have been done and how we integrate what we do every day into the lessons that have happened in our health classes. So it's been a great partnership for a very long time. This seems very natural for us to be partners.
And what grade levels you're talking about? Middle and high school?
Middle and high school. Yep.
Okay.
And at the elementary level, I think the mental health regulations and the school counseling regulations meld themselves really easily when we work with students to ensure that they know what feelings are, how to regulate their feelings, how to make sure that they're mindful about what is happening around them. All of those help with the foundation of good mental health and what to do, and resources within the school and at home that students can access.
And at the secondary level, we have, in our school, we have a grade level assemblies where we discuss substance abuse, alcohol abuse, trends in terms of, what are students choosing to unfortunately use, and how to prevent this becoming an epidemic within our school district. And so we also talk about suicide prevention as well as bullying, also about exclusivity and just making sure that that is identified as a form of bullying and abuse and, towards one another as peers. And so we, as school counselors, are available to our students post-assembly to discuss what the content of the assembly was, as well as any personal relationship that they have with that certain topic. The other team approach that we have on a more intimate level is the instructional student team, which is IST or child studies. Some schools still call it as child study teams. And so we not only discuss the issue, but we also come up with ideas and resources to prevent and also just taking measures or steps and giving them resources in-house as well as in the community.
The other piece that I found to be really interesting is that yearly meeting when they're meeting with their school counselor has turned into more than just an academic schedule meeting. It's really about their overall wellness. So how are you feeling about yourself? How are things going socially for you? Which leads us to get a better picture of a student's throughout the entire year. So it was a neat piece for us to add, and it just made sense.
And I'd love to piggyback on what you just said. I know we've had the opportunity to help train our staff so that they know signs to look for. And they were really appreciative of that information and much more willing to come to us so that we could help support our students, because we work as a team to make sure that they're doing well.
Certainly professional development is the first piece, and then take a full assessment kind of approach to this and think about what are you already doing at the elementary level, at the secondary level, and then think about how maybe you could expand upon that. What are you prepared to do? What infrastructure do you already have in place that would support it? And then thinking again globally about your families and your school staff as well. So it's not just
Informing families as well as students.
Absolutely. Educating them as you're educating students, and that's so important.
Well, the process you describe, it sounds exactly what school counselors are looking to do to develop and update their comprehensive school counseling plan. The comprehensive plan is a way to bring it all together and help a school take a look, an inventory, so to speak, of what are we doing? Let's gather it all together. So it sounds like mental health and wellness is a good topic to do this for your comprehensive program. Let's take a look at what we're doing, who's doing what, and what are the gaps? What are we missing? What grade level really isn't getting anything?
We often take a look at honing in our skills with mental health. And I've been really impressed with looking on the Resource Center's website for the resources that are professional development for our school counselors. Can you talk a little bit about some of the programs that offer professional development specifically for
Absolutely.
counselors?
What we think is a really great program, it's an evidence-based, standardized program that we've been using for a long time, is called Mental Health First Aid. Mental Health First Aid, or Youth Mental Health First Aid, is for folks who work with children. And it teaches people to recognize when someone might be experiencing some challenges. And we use the word challenges not necessarily to say that they have a mental health disorder, but lots of people experience mental health challenges, and they may not have a disorder. So it's recognizing when people are experiencing these challenges and then providing them with the tools and the skills that they need to stay well until professional help can be made available. But if you can't train everybody, and it's probably not practical, we offer Mental Health Wellness 101, which is a 1-hour, very basic training. We talk a little bit about signs and symptoms, but it's really focusing on sort of a universal approach to mental health. And we definitely think that professional development is an important piece of the puzzle.
My question is, in terms of cultural implications, as you know, as you're aware, mental health or wellness is viewed differently across the board when it comes to various cultural backgrounds, be it racial background, ethnic background, or even socioeconomic background. And so I would pose two things. My challenge is like customize and differentiate and providing those services and resources to various types of student families, that it wouldn't be like a cookie cutting resource, but what can you tell us about, in terms of cultural implications?
Yeah. that's definitely something that we need to make sure that we're paying attention to. We posted on our website a series of lesson plans in recognition of World Mental Health Day that included some that looked specifically at different cultures, different cultural beliefs. We looked at things like mental health and refugees. What we really need to start with is our own biases. So it's hard to sort of teach cultural humility because even within a given culture, there is lots of differences from person to person, just as you would expect. So we really talk about those biases and just examining our own biases that we might have and how that influences our work. But I'm glad you mentioned that. We also did put a translation tool on our website, trying to respond to those kinds of needs.
Well, it's very much a part of the comprehensive plan. It's so specific to your school so that you can accommodate and keep in mind some of the specific cultural needs of your students. But it is a challenge. It is a challenge to always be aware of the different influences. It sounds as though you are doing quite a few things already to address mental health and wellness. But I also have heard that counselors often feel like they're not doing either anything or enough. It's an interesting dichotomy there. You clearly are doing some things, but there's a sense that there's more that you should be doing. What are some of the challenges in your setting at the level that you work at for addressing some of the gaps?
A lot of districts share this concern is that we're understaffed. And so my district is quite diverse, and we have a great amount of students that come from Central and South America. This is an ever-changing district that at one point is going to become mostly Spanish-speaking students that recently came as unaccompanied minors. So that is a challenge. The other challenge is when it comes to wellness and mental health, the whole stigma that going to seek outside help with a counselor, a psychologist, that means that I'm crazy. So the whole, the stigma that the culture involves, the Latino culture involves, that is my specific example in terms of challenge. I wish we had more resources in the community, and we're working on that, to have more mental health practitioners out there that we can say, here is a clinic or an office or a person that you can go to, especially with the Spanish-speaking population. So.
I think having the time to map, to do some curriculum mapping, because everything is important. Certainly it fits in our social studies curriculum, it fits in our ELA curriculum, but having the time to really do the mapping has been a challenge.
Time, staffing. Kathy, do you have something to
Yeah.
add to that?
Well, in the population that I'm serving as elementary students, with the research, a lot of the elementary characteristics that we see don't get necessarily diagnosed till later on in middle school and high school. So or at least what we've seen is an increase in anxiety, an increase in separation anxiety, and the concerns that comes from that avenue with worries. But I also share, we have a short list of resources that we can share with families who are seeking out support. But I think having an elementary presence as a school counselor also provides a proactive approach to families reaching out and accepting some of the support and resources that are available. So I think that although it's a challenge, is also a positive component.
One of the things that we added very recently across the top is find your local resources. So you can click on, I think it says find a local resource, and pick your county, and it drops down with kind of a list of resources that are kind of ready and handy. So
I think we need to get the message to not only our administration, but to New York State, to the Board of Regents, to the governor's office, that clearly the intent is there, the heart is there, but with staffing that doesn't really allow us to do the full job, with the lack of resources, with increasing needs, all the good intentions and resources isn't enough. It really is not enough, and that needs to be acknowledged. One final thought, because we are not alone in this, we've talked about health educators. We also, maybe you have social workers available in your building, maybe school psychologists that are readily available, maybe clinical mental health counselors are also sometimes in schools, sometimes agencies are in schools. How does that play out in your schools?
We work as a team, and we tend to work from our strength and, as the different members of our mental health team, so to speak. We all work together to try to help with all the wellness issues, and that seems to work. Of course, we're always, at times pulled, but that teamwork, I think, is integral in helping each student.
Amazing, amazing people. But again, we're all on the same boat. We're really, there's a lot of work to be done. And again, it's not just about how huge these caseloads are of students that we want to serve, but it's the needs.
We do a really good job with a team approach as well. We have various professionals that work together to meet the whole child where they are.
And I thank you for both your expertise and to bring some examples from the field, from where it's really happening, as we look to address this very important topic. And thank you all for joining us. I'm Gloria Jean with the New York State School Counselor Association.